Hi there, how are you?
Hey Jill, how are you?
I'm well, thank you. Hi.
Hi.
Let's fix something here.
So for whatever reason, we have a pretty tiny crowd registered. Hi,
All right.
how are
Nothing I'm
you?
not used to.
Yeah, no, you just never know. And I know it's not the first time you all have done your presentation, so
No, it's all good. Thank you.
yeah,
How's it going? How many people do you have registered?
4.
4? Okay, that's fine. We've done with less, so.
Really? Okay.
Yeah, we've talked to a crowd of 0. Never know. You'll never know which one.
Well, I'll tell you, this is the first webinar I've done. So if there's anything I need to do, let me know.
Yeah, so I don't know if you have practice mode on.
I don't think so. I started the webinar, so this should be
Okay.
the live thing.
Yeah, so I think it's really straightforward. It's even better because people can't talk, so their mics don't switch on and off, and that's honestly it's beautiful.
We've had some pretty rough Zoom bombing as on our learning curve, so I'm just as happy to have the webinar.
Yeah.
It is recording.
Oh, it is. Oh, you can pause it. And
Hello, and welcome to our session this evening on the science of COVID vaccine. My name is Jill Skwirsky. I'm the Engagement Services Manager at the Evanston Public Library, and we're happy to have you with us tonight. I do want to give a heads up that the session is being recorded and will be on our library YouTube channel just as soon as it's ready to go. And with that, I'm going to turn it over to our expert panel from Northwestern University's, and I'm going to let you guys define the school because I'm going to misinform. So thank you all. Enjoy.
Welcome everybody. My name is Kyle. I'll be moderating tonight's event along with Reese. The other 2 people that we have here with us from Northwestern are Catherine and Frank. Frank will be giving a short presentation about the science of COVID-19 and just some information about the vaccine and things like that. Feel free during the presentation to put any of your questions into the Q&A part of the chat. Try to keep them out of the public chat just because it'll get a little bit too congested in there. So, and also just to make sure we get to your questions. So the presentation shouldn't last too long, and then we can jump right into an open panel of questions. So without any further ado, I'll hand it over to Frank.
All right, thank you. Okay. So as we heard in that great introduction, we're a team of scientists and science students from Northwestern University. And we're really excited to be here today and talk a bit about the science behind COVID-19 and the vaccines. I know everyone's probably a little bit sick of hearing about COVID, no pun intended there, but I think knowledge is really power. And so it's important for us to sort of like try to spread some knowledge and be on the same page. And ultimately, that's how we will sort of defend ourselves from this virus and other viruses in a swift and safe manner. And so this is our team. There are 4 of us here today, but there are others who have contributed a lot to this project over the past few months. And so, yeah, thank you to all of them. So in order to really understand how viruses work, it's important to understand a little bit of basics in biology. And the first thing is DNA. How does DNA work? What is DNA? So DNA is what people refer to as your genes or your genetic material. And we can basically think of it as the blueprint for a living organism. So anything that's alive has DNA. A tree, an apple, an ant, or a human. We all have DNA, and our DNA varies because the DNA is the blueprint instructions for basically creating a living organism. So everyone's DNA is a little bit different. And these are the things that dictate your natural hair color or your eye color or your height, things like that. Your DNA, for all those reasons, is a really, really important molecule in your body. And so it's protected and it's housed in a compartment called the nucleus. So the nucleus is this little protected compartment on the inside of your cells that stores your DNA and basically prevents other things from interacting with your DNA and messing it up. Because your DNA is always kept in the nucleus, the blueprint is kept sort of locked away, safe. Your body uses this thing called mRNA to actually communicate the instructions of DNA to different parts of your body. So you can think of mRNA as sort of like small photocopies of parts of this blueprint. So one mRNA molecule might code for just one protein or one tiny part of your body, not sort of like a whole arm or a whole leg or a whole person. So we can think of mRNA as this short, small instructions or like a short photocopy. So now that we know about DNA and RNA, we can start to talk a bit about what a virus is. So to put it really simply, a virus is basically a bubble with some RNA on the inside and a few proteins on the outside. And I'll talk about each of those components a bit. So viruses, because they only have a few different components, they don't have the ability to create their own proteins. They can't eat food and turn it into energy. They can't reproduce. So there are all these things that viruses can't do, which is why they need to infect us. That's why they need us, because they need to basically steal the machinery inside our cells and use it to create more viruses. So the way a virus works is by actually making its way into your cells and releasing its own RNA molecules. So it destroys all the mRNA in your cell, and its own mRNA is then used to create more viruses, basically using the systems contained in your own cells. And the way that your body responds to this is basically it tries to kill the virus. It tries to basically sweat it out by increasing body temperature, and that's what's known as a fever, and creating inflammation and recruiting all sorts of immune cells to the site of infection to try to basically prevent the spread of this virus. So coronaviruses are called coronaviruses because they have this sort of characteristic crown or a corona on the outside of the virus. This is sort of named after the corona of a solar eclipse. So on the top is a really high magnification image of a coronavirus, and on the bottom is a solar eclipse. Coronaviruses are RNA viruses, as I mentioned. So they release RNA into your cells. And other coronaviruses include things like the common cold. And as I mentioned, there are all these different systems that are, or symptoms that are different ways that your body basically is responding to the presence of a virus inside you. So fever is sort of the main way that it tries to destroy the virus once it enters you. But there are also all sorts of other things that happen: sore throat, muscle pain, chills, coughing. And some of these symptoms are protective and others are basically ways that allow the virus to spread. So coughing is sort of the main thing that people might think of for how illnesses tend to spread. So we can sort of combat all these things and prevent viral spread by doing a few things. They call it like the 3 W's. So watch your distance, wash your hands, wear a mask, et cetera, et cetera. And also, of course, vaccines are a really important way of protecting against viruses. And I'll go into that a little bit more. So let me just make sure I didn't skip. Oh, here's a slide that is definitely important to mention. So this is a basic structure of a virus, a coronavirus to be exact. So to be clear, SARS-CoV-2 is the name of the actual virus particle shown here. And COVID-19 is the name of the illness that this virus causes. So as I mentioned, the virus is basically 3 things. a bubble that contains RNA. And then the third component is this spike protein on the outside. And we can think of the spike protein as basically a key that allows the virus to enter your cells. One way that your body combats viruses is by creating antibodies, which are basically meant to block and gum up all the keys so the virus can't sort of unlock and enter into your cells. And so now we're ready to talk about vaccines. So the reason that we need vaccines is because your body fights viruses by creating antibodies. And so each virus needs its own vaccine, just like when you get a virus, you are then immune to that one particular virus. So if you get the chickenpox, you won't get chickenpox again because you already have antibodies for chickenpox, which are basically the molecules that block the virus from spreading in your body. The way that, so vaccines are essentially a safe and effective way of training your immune system to identify and destroy a specific disease or virus. So when you get a vaccine, you're not actually getting the antibodies for the virus, but you're getting instructions that allow your body to eventually make antibodies. So the way that scientists do this is they'll take a look at the spike protein, which remember is the key that allows the virus to enter your cells. And they will use the mRNA instructions for small fragments of that spike protein. So basically they take these mRNA instructions, put them in a bubble, and that's, to be very simple about it, what the virus is, or what the vaccine is. So the vaccine will basically contain this bubble with the mRNA instructions for these small fragments of the spike protein. And basically what the goal of this is showing your body all these different views of the key that SARS-CoV-2 is trying to use to actually infect your cells. So once your body can recognize the key, it can then produce antibodies to actually basically block this key and block the virus from entering your cells. And this is how we ultimately achieve immunity, by creating antibodies. And then once we have the antibodies, our cells remember how to make them. So we're basically giving our cells some like inside info and like a sneak preview of what the virus looks like, hopefully before we ever actually have to encounter the real virus. We're seeing sort of like a dummy version of the virus. And this is in part why we see some symptoms upon your first vaccination and even after your second vaccination. So after the first exposure to a vaccine, you might feel some chills or a bit of fever or some soreness. And that's basically your body seeing these tiny components of a fake virus and acting accordingly. It's getting its immune system sort of boosted up. Maybe it'll cause some inflammation, cause some chills, to raise your body temperature and stuff. And this is the way of your body actually preparing to fight the virus. And then when you get your second vaccine shot, some people often report that the side effects after your second vaccine are worse than the side effects after your first vaccine. And that's because your body is seeing this these components of the virus, this sort of dummy virus that is contained in the vaccine. And it's acting accordingly and sort of going into overdrive, trying to fight it off and bring up all those antibodies for COVID. And this is how your body sort of like completes its training and gains final immunity against a virus. So now we can talk a little bit about the different vaccines and how they work and how they might be useful for us. So there are currently 3 FDA approved vaccines in the US. The Pfizer vaccine was recently approved, I believe, for people ages 12 and up, which is very exciting news. And the Pfizer and Mrna vaccines are both RNA vaccines. The Johnson & Johnson is DNA vaccine. They all work in sort of similar manners, and basically grant you immunity after either 2 weeks or perhaps 29 days in the case of Johnson & Johnson. But this time of 14 days is also after your second dose. That's important to keep in mind. And there's been a lot of talk about these efficacy numbers, 95%, 94%, 92%. And I think those are sort of interesting things to think about, but it's also important to take a step back and sort of consider where those numbers are actually coming from. So when they report vaccine efficacy, this is basically based on a group of hundreds and thousands of people that they monitor when they're testing these vaccines for efficacy. So this is in the final stage of clinical trials when they've already established that the vaccine is totally safe for humans and it has at least some effect. Now they're just trying to see, well, how effective is it? Is it good enough that we can like release it into the market, et cetera? And so we see all these different numbers for efficacy, and sometimes people will compare these numbers. And it's really hard to actually make comparisons between each of these efficacy rates because each of these vaccines were developed at different times using different study conditions. And so strictly scientifically speaking, we actually can't draw direct comparisons between the efficacy of like Mrna and Johnson & Johnson, for example. But that being said, they all have really high rates of preventing symptomatic COVID. And another thing to consider is actually the Johnson & Johnson vaccine was developed a little bit later than the first two vaccines. And this could have very likely been when more variants were sort of circulating throughout the United States. And I'll get into variants a bit more, but basically some of the variants are more contagious, more infectious, and also might be a little bit stronger against the vaccines, which is why perhaps we saw that this efficacy was a tad lower for Johnson & Johnson. Nonetheless, all of the vaccines are very effective at preventing severe COVID, and even more importantly, they're all 100% effective at preventing hospitalization and death as a result of COVID-19. And this is really the bottom line. And this is the part that's going to save people's lives at the end of the day. And this is why it's so important to actually get the vaccine. Because if you get the vaccine and then you're exposed to COVID, there is a 100% protection against hospitalization and death from COVID illness. And so this is a little bit out of date, but once you get vaccinated, you know, you're protected, you're fully immunized, you can have your vaccinated friends over, you can go outside without a mask, and basically you won't have to worry about getting COVID in those situations. It's still important though to avoid large gatherings. I think that's going to be sort of a common theme for a while probably. And also sort of maintain masks and social distancing when you're like indoors in sort of like a crowded space, maybe like the grocery store or on a bus or on the train or something. It's a good idea to wear a mask and try to spread out if you can. And so how does life return to normal? One way that people have suggested that this could happen is through herd immunity. And herd immunity is basically the concept that once enough people have become immune to a disease, either by vaccination or by getting the disease and then overcoming it and building immunity to that disease, it prevents spread of the virus because basically there just aren't enough people for the virus to spread to. So normally a virus has to spread from person A to person B to person C and so on and so forth. If it can only jump from person A to person B and then can't find a person C who isn't immune to the virus, then the virus just eventually dies out and disappears and it's gone and a thing of the past. And recently, it's become sort of a hot topic of conversation. Herd immunity might actually be kind of difficult for us to achieve. And there are basically two main reasons for why this is the case. The first reason is the presence of variants, as I mentioned. So variants basically occur when the virus is able to spread from person to person to person and make many, many more copies of the virus. So eventually millions, billions of copies of this virus will exist. And every time it gets copied, there's a small chance that the virus will mutate. And sometimes these mutations do nothing. Sometimes the mutation makes the virus just die. But sometimes the mutations actually make the virus a bit stronger. So we've heard about some of the variants or some of the mutants arising that are a bit more infectious. There's one from Great Britain, which is now sort of the dominant strain in the US. And it's much more infectious than the original strain of COVID that was very prevalent in the US. And so as these variants begin to circulate and continue to circulate, it makes it a bit harder for us to get herd immunity, because the more infectious that a variant is, the higher percent of people need to be immune for herd immunity to actually work. The other reason why herd immunity is sort of a difficult goal for us to reach, but maybe still attainable, is because people seem kind of hesitant to get vaccinated. And there could be a lot of reasons for this. Maybe people are worried about side effects, or just having trouble getting access to the vaccine. And in order for us to actually achieve herd immunity, it's really important that as many people are immune as possible. And this is why it's really important to sort of like spread the knowledge and learn more about COVID, so everyone can sort of make an informed decision about getting vaccinated. I think a main goal of this activity here today is not only to spread information about COVID, and maybe you'll learn something new about COVID-19 and the vaccines, but you also might, even if you don't learn new information, you might learn new ways to think about it and new ways to tell your friends and family about it and encourage them to get vaccinated, encourage them to get immunized. And I think that's a really important way of how we can all sort of bring a swift and safe end to COVID, hopefully sometime in the not too distant future. And so that's pretty much it. Now I'd like to open it up to some questions and answers. And yeah, please feel free to submit any questions you have, and we'll do our best to address them. And yeah, thank you so much for listening.
Thanks, Frank. Great presentation. Thank you for touching on all the important parts of coronaviruses, virus structure, and as well as the vaccines. Very informative. Like Frank said, we're going to open it up to questions. I don't see any in the chat currently, but there have been a few that have been pre-submitted. One of those being another hot topic question about why does the second dose of the vaccine seem to have such a higher rate of symptoms than the first dose? And I think Reese has answered this question in the past, and he's excellent at it. So I'm going to hand it over to him.
Sure. So basically, the first dose is your body's effective first introduction to the spike protein itself. So the first dose gives your body a chance to recognize that protein. And after the first dose and your body has had a chance to acclimate to the protein that is transcribed via the RNA vaccine, in the second dose, where your body is reintroduced to that spike protein, it then, because it recognizes that spike protein, activates an immune response. So you start to see some of the same symptoms that you would see with fever, fatigue, achiness, elevated temperature, etc. And that's entirely what you see when that happens. It doesn't happen to everybody, and the reasons behind that are very complicated and not well understood. So if you don't have that sort of reaction, it doesn't mean that you are not immune. It doesn't mean that you're more immune. You shouldn't take it to mean anything. It's just that this is an entirely normal thing to happen. You should not panic, and it usually goes away within about 24 hours. It usually sets in about 24 hours after the shot and then goes away 24 hours after that. So yeah, entirely reasonable, not unlike a regular fever, and it goes away quite quickly.
Yeah, so I mean, there are other concerning side effects, but definitely within the realm of normalcy is that achiness and the site injection pain, as well as that fever. That's just your body trying to fight it off. But you know, there could be other probably more serious side effects, perhaps fainting, which have been kind of documented in people, but you know, they're not very common. So those are the ones you really want to be more cautious of. And if those do happen to you, you should talk to your doctor or go to the emergency room if it's an emergency.
Thanks, guys. Excellent question, or excellent answers to that question. Going off of some sort of symptoms of vaccines, we had a question about the J&J vaccine again. As we all remember recently, the J&J vaccine had a period of time where it was recalled due to possible blood clotting in a certain demographic of patients that had received it. The J&J vaccine has since been reinstated as of May 6th, I think was the date, and it's been approved by the FDA for use. So just as a general question, why did the CDC pause the dispersion or dispersal of the J&J vaccine?
Yeah, so a lot of it is due to public trust, and of course they want to review the case. So initially when they stopped the J&J vaccine, it was, I think, 5 people that had pretty severe blood clots in unfavorable places of their body out of 7 million at that point doses that were given. So it is, yes, an incredibly rare event. The demographic of that initial group, I believe, was women from 30 to 60 years old, if I'm not mistaken. So since then, they have reviewed the case and they found, I think, 7 more cases that were linked to it. So that was up to 15. I do believe at least 1 person died, but then they did kind of designate that it was extremely rare event. And actually, I believe that person died because they were administered heparin, which is a anti-clotting agent. And that was more the treatment that really caused death, unfortunately, and not really due to the vaccine. So it is an incredibly rare case that this vaccine will cause a blood clot. And if you do have a concern about that, you know, talk to your doctor to see if the J&J vaccine is for you, or, you know, there are 2 other perfectly safe and effective vaccines that are out there, Pfizer and Mrna. And yeah, I think I answered most of that.
Thank you, Kat. So we do have a question in the chat. The question is, my son, although university educated, is suspicious of vaccines and big pharma in general, and mentions that he will not get the vaccine. What are some ways to convince him otherwise?
Yeah, this is a difficult one. I think just talking to people about it, you know, listening to their concerns about the vaccines. I guess that's what we're trying to do here, really. In general, you know, kind of try to talk to their, talk about their issues. I think most people are kind of hesitant because it's such a vaccine that had been developed in under a year, which is pretty unprecedented. We can answer that question in a later thing, but one thing to keep in mind is that this vaccine, although very rapidly developed, has undergone all the safety trials that every other vaccine has gone through. There were no corners cut. There are reasons for why this vaccine clinical trial was so rapid, which we can talk about later. Yeah, I mean, it was just a lot of hard work, a lot of funding that went into this. But I say ultimately you should listen to his concerns and then just kind of try to find information that will address that and listen, really.
It's important to note as well that a lot of people's fears about vaccinations and the roles that companies like Pfizer, Moderna, and Johnson & Johnson are playing in our pandemic do come from places of genuine concern. Like, it's not okay when pharmaceutical companies hike up the prices of drugs, and it's okay to be distrustful of big pharma. At the same time, the FDA and the CDC and the World Health Organization are indebted to the people of this country, right? And this was developed in tandem with public and private researchers for the betterment of mankind and to end this pandemic. And ultimately, getting the vaccine is an act of care, not only for yourself, but also for others around you. So I found when talking to people that are skeptical, it's important to acknowledge where those fears are founded and where people might be misinformed, because they're not necessarily the same thing. Being fearful of something and being misinformed can come from two very legitimate places, but two entirely different places. So being able to recognize all those different facets is an important part of having an honest and effective conversation when it comes to vaccines.
I want to take a minute to just jump in here. I sit on the city's vaccine information working group to help share information about the vaccine and build trust. And there is available on the city's YouTube channel and the library's YouTube channel a video that was put together that addresses some of the concerns that we have found residents have about taking the vaccine. So there are some ETHS grads in that video. There are some well-known figures from the community actually getting their vaccine live on that video and speaking directly to some of that hesitancy. So if that's something that would be useful, you can again access that on the library's YouTube channel. Thank you.
And I want to say, like, all of us here have, put our money where where we're trying to address these concerns. So we've all gotten vaccinated. I think all of us have both our doses, and I'm at least 2 weeks beyond. I'll say that although I was completely expecting to be bedridden the second time, I had no side effects whatsoever. So yeah, I mean, I feel great, and I'm looking forward to ending this pandemic. So I don't know if you guys want to share your experiences.
Yeah, that was a great. I think it was great answers overall for everyone. I guess as personally, as someone who's had people in their family, and I have current friends who are very hesitant about taking this vaccine. I think it's important as an educated individual to weigh that decision. I think that's, as humans, that's how we make a lot of our decisions, is just by weighing just simple pros and cons. And I think as someone who who claims to be educated and who is educated would be able to easily make that decision where the pros definitely outweigh the cons for getting the vaccine. So and it's a conversation that just to continue on that, it's a conversation that really we're not going to stop having, even especially as the pandemic starts to go away and things like that. there's always going to be a what if, or, oh, I didn't get the vaccine and look, I never got COVID. And there's always going to be those people in that small percentage. But I think it's important to remind people to keep looking at the big picture. So thank you for that. And in terms of the big picture, we had another question that really fit in here with where we're going here with the conversation. And that is, would it have been possible without vaccines to just reach this herd immunity, this term of ending the pandemic? So would we have been able to get out of this without a vaccine?
I can answer that. Getting out of it, it depends on what you mean by getting out of it. If by saying, oh, there would be very few infections left, then yes, that would probably happen, but it would happen at the expense of a lot of deaths. So across all age groups, the infection fatality rates for COVID-19 with good medical care, so with constant medical attention, is around 0.4 or 0.5%. If the virus were allowed to run rampant without vaccinations, without social distancing, without other mitigation measures, we would expect to lose about 0.5% of the population, probably even more, because of medical shortages associated with the high number of hospitalized people and high number of deaths. So there are ways to reach herd immunity, but they come at the expense of human life. And that's ultimately why vaccinations are so important, because they can prevent the loss of human life while getting us to a threshold where we can actually end the pandemic and end onward transmission of the virus.
Thank you, Reese. That's a great answer. That is, we would have reached herd immunity one way or the other, but at a great cost. So going along with the vaccines, so we've heard about some of the short-term effects, the chills and the fever right off of getting your first or second dose. But what about some of the longer-term effects of the vaccine? Are we sure about some of those, and what types of things have we found out?
As well. Yeah, so what's really interesting is that, apparently in the course of the history of vaccines, even back in the primitive days of like literally scraping someone's smallpox and putting it on someone, in the course of vaccines, there are no long-term effects longer than like 3 months post getting your injection. So that's to say you won't have a random thing that pops up that can be correlated back to this vaccine, 3-4 years down the line. So when we talk about long-term effects in terms of vaccinations, we're actually talking about of the month, 2 to 3 months after you get vaccinated. So in terms of those, that was covered by the clinical trials. So all the clinical trials have to be over 2 to 3 months of observation. And because of that long-term effect of the vaccine. And obviously, because they were all approved, all of them were deemed relatively safe, or safe. Depends on your definition of relative, I guess.
Thank you, Kat. Just to piggyback off of that, in terms of long-term vaccination, the thought process of long-term vaccinations, do you think that we'll ever have to have a booster shot, maybe a year or potentially 2 years from now?
Well, that will really depend. I think there are a bunch of studies that kind of predict that it will be something similar to the flu shot where you just go and get it annually. Right now, I think most consensus says we don't know, because we don't know what types of variants will arise in the near future, or how vaccinations will play out. And obviously, the more vaccinations, the better. So again, like that's an interesting thing, because we have a number of these variants, the UK variant, the South Africa variant, and I think India's variant is now a different one that is also highly infectious. And if we continue to get more and more variants, the likelihood is that we will need those yearly booster shots to keep up with those variants. But again, to point out that these variants arise, as Frank mentioned, due to unfaithful transcription or reproduction of the virus. So the more people get vaccinated, the less likely that these viruses can even replicate. Actually, the lower the probability we will even have any more variants in the future. Another major reason why we should all get vaccinated as soon as possible.
Thank you, Kat. Yeah, we can't help but stress the importance of the vaccine, clearly. So I guess with more, we have some time here, about 15 minutes or so. It seems like the conversation's kind of moved towards vaccine hesitancy. So I think one of the big points of vaccine hesitancy is that people in general are worried that it might change their DNA. And Frank gave an excellent introduction to how your DNA is protected and encapsulated within a cell before, but I'd like to expand a little bit on that. So why can't mRNA vaccines like the Mrna vaccine, why can't that affect my DNA?
I can take this question. So I mentioned before, I use this analogy of DNA as like the blueprint for a living organism. The DNA is like the blueprint for your body, and the RNA is basically a small copy of a piece of that blueprint. So the vaccines actually contain, or at least the Moderna and Pfizer vaccines contain mRNA, and the Johnson & Johnson contains some DNA, but none of those objects actually make it into the nucleus or the compartment that is containing your DNA itself. So they will never be in the same place as your DNA, and they will never be able to actually interact with your DNA. So all of these compartments will be sort of floating around outside while your DNA is still sort of locked away and protected. And basically, for that reason, the vaccines can't change your DNA itself. They're just giving you some new instructions so your body sort of knows what the virus looks like.
Yeah, that's a great explanation. I think also, especially for the Pfizer Moderna, which again are mRNA instructions, mRNA, as we know from these really low refrigeration temperatures, they're really not stable. And we have mRNA in our own bodies. Pretty much everything that is made into an active component of your body is somehow derived from mRNA. And mRNA doesn't stay in your body forever. It's very unstable. It's constantly degraded, even your own. So that's why these vaccines are also safe. They don't stay in your body for very long. The vaccine is intended to give your body a kickstart and give it the instructions, but those mRNA instructions for the virus are actually degraded very, very rapidly because again, it's not stable, which is why we have these very low refrigeration temperatures that are causing some kind of problems with storage in vaccination clinics.
Yeah, definitely. Thank you for that answer, Kat. So as you've heard from both Frank and Kat, the vaccines will not be able to affect your DNA. So as far as a return to normalcy, we've heard of some examples of people getting their first vaccine and then getting COVID. And people have made the connection that, well, that's proof that the vaccine is ineffective. So I think that misconception arises from the fact that as soon as you get the vaccine, that you're completely protected and there's nothing you have to worry about. But could someone answer or explain a little bit more why it's important to really go get that second dose, not just get the first one and say I'm fine, but why is it really important to complete the doses?
Yeah, so I'll take a stab. Actually, and even when you get 2 doses, there's still a probability of you getting COVID. Remember that the numbers, the efficacy that you see is just measuring symptomatic COVID. So you're 95% protected well, not 95% protect, sorry, 95% of the tested population was protected against symptomatic COVID. So that is one part of the answer. And ultimately, the point of the vaccine is to make sure people don't die, and that people don't get severe COVID or this kind of long COVID as we're talking about. And all these vaccines really are effective at that. As Frank mentioned, they're 100% effective at preventing hospitalization. To say again, if you get the first dose, you're somewhat protected, although lower. So again, that would be the first time your body has been introduced to the COVID virus. So it's kind of learning very slowly, kind of, is this my own body or is this a foreign thing that's going to harm me? And then, you do get some protection against it, but really there's a reason for the second dose that they chose to do 2 doses for Pfizer and Moderna is because that second dose will really kickstart your immune system. Your immune system will recognize it again and be like, oh, I've seen this before. I know how to fight it. And then mount a really, really like big immune response, which is again why we get all these nasty symptoms, unfortunately. But yeah, there is some protection from the first dose. There's definitely more protection from that second dose in a more safe manner.
Thanks, Kat. So we have another question from the audience, and I think it's really important to highlight this. Our question states, so the idea that the vaccine doesn't actually stay in your body is an important one. So our attendee is asking, if the vaccine goes in, so the vaccine goes into your body, it triggers your body to act in a certain way and then dies. Is that correct?
So that's a really good question. It's never alive in the first place. That's a really important thing. So for the Pfizer and Moderna vaccines, all that's going in is the genetic code that encodes the spike protein. Nothing else from the virus actually makes its way into your body. The spike protein on its own can't actually harm you. So that actually just allows your body to recognize that spike protein. Other vaccines like the Johnson & Johnson vaccine or the AstraZeneca vaccine that's used in Europe and the UK actually have what's known as a non-virulent virus deliver that same genetic material. And that virus, again, is incapable of replicating. All it does is it goes in, it encodes the genetic material, and it dies. So yes, in that sense, it does die afterwards. But the important distinction here is that these vaccines never had the capability of giving you disease in the first place. They just encode important parts of the virus that allow your body a chance to recognize the virus should it ever enter the body.
So you're saying the word dies, and I think that is an appropriate word for some things, but definitely not in this case. So there are vaccines that use attenuated, which are weakened or like somewhat dead viruses. But again, these vaccines are DNA and mRNA instructions, and those are never alive to begin with. So actually the terminology, maybe you've heard us before say, is degraded, because it does get degraded or destroyed. Yeah, I don't. Yeah, they're not alive to begin with. Yeah.
But just to put a cap on that, I think a big concern in vaccine hesitancy is the vaccine is gonna stay in your body somehow for a long time and give you long-term effects, in fact, or somehow affect like fertility or your long-term health. And the science really is that it doesn't do that. The vaccine goes in your body, does what it needs to do, and then it gets destroyed, degraded, and it's gone.
Okay, great. I think we have time for one more question, and I guess we can keep it as a pretty simple one. So something that you might have seen in the news recently is examples, or maybe an example of someone going and getting a Pfizer and then going and getting a second dose and getting it as a Mrna. So I think it's pretty intuitive that that's probably not the right way to go about it. But just can we elaborate on why that's not a good call?
Sorry, my cat is telling me not to make a joke. So the joke is that we call that the Arnold Palmer or the Arnold Pharma. But basically, intuitively, it would seem as though you would be able to get one Pfizer, one Moderna, or one Moderna and one Pfizer, because they both encode the same thing. They just have slightly different delivery mechanisms. In practice, it's important to note that that hasn't been tested clinically. So each vaccine on its own has received rigorous clinical trials of upwards of 50,000 individuals each, just in the United States alone. And there haven't been clinical trials testing different combinations of different vaccines. So if you are considering it, it's important to know that it hasn't been tested. There really is no advantage that any biologist can think of, and it's generally not recommended. So yeah, that just about answers it. There are some people that have done it accidentally. And as far as we know, there's no ill effects to it, but again, there's no advantage either. So just don't do it.
Thank you, Reese. Thank you for everybody. Thanks for the great questions from the audience, and thank you for everyone for their insightful answers and elaborations on everything. So it's getting pretty close to 8, so I will hand it back over to Jill to have a few closing statements about some information that is available for the public.
Great. Thank you all for the presentation. Nice job. We appreciate you joining us at the library to bring this information to the community. I do want to just end by letting people know how they can register to get vaccinated within the city of Evanston. City of Evanston has its own certified health department, so we receive doses directly from the state to immunize anyone who lives or works in Evanston right now. And really they're loosening even those parameters. But cityofevanston.org/vaccine is the registration site. Or you can call 311 within Evanston and they will help folks get registered for the vaccine. Erie Family Health is currently taking some walk-ins, so you can just walk in on a daily basis, and as doses permit, they will vaccinate you on the spot. And lastly, I would mention the Cook County vaccination sites. The closest one to Evanston is in Des Plaines. And again, as of this Friday, I believe they are vaccinating anyone 12 and over with the Pfizer vaccine. So those are some of the options. There are others: Walgreens, Jewel, Meijer. There's a number of places to get vaccinated. So depending upon your comfort level, you can choose from any of the above. So again, thank you. We'll put the recording up on the YouTube channel. And with that, we will call it a night.
Thank you for having us.
Good night, everyone.
Good night.